abatugoberera ku mukutu guno ogwa Namu Media mwenegaite ku tusobole okweyanza Dr. Lubite Alan ngono ni Dr. waife ow'eddwaliro lyaife erya Nsinze Health Center 4 eryaganibwa mu Namutumba district. Olwo omulimu omulungi gwali kukola okukyusa eddwaliro lyaife lino. Sebo Dr. Lubite Alan tukweyanza nti okuva bwa posting bwa kwidwaliro lino nga dokta okoze kyamaani ino okukyusa omutindo n'emboneka y'eddwaliro lyaife lino, kubanga eddwaliro lyaife lino lyalinga liri mu mbeera mbi, aye okuva bwe waida buli kintu kigire nga kikyuka. So luteekwa okwebaza era nga mu byafaayo eby'eddwaliro lino kidda kuwandiikibwaku era kidda kwogerwaku Sebo Dr. Alan Lubite nti ng'oli mukulembeze gw'eddwaliro lino ng'ate era niwe dokita ow'omukaaga mu byafaayo eby'eddwaliro lino erya Nsinze watuleetera ekifo gye bakuumira abaana baife abato abazaalibwa nga bakaali kwetuuka. Kino ekifo ekitabangawo mu byafaayo eby'eddwaliro lyaife n'erya Nsinze. Nti Sebo kidye ku mulembe gwo kyetukweyanza nti weebale ino banyabo ni ba Sebo nga bwe muli kubona mu bifaananyi ebyo. Ekyo n'ekifo gye bakuumira abaana baife abazaalibwa nga bakaali kutuuka ekiri ku Nsinze saawa eno ekyazimbibwa mu Nsinze Health Center 4 nti buti saawa eno abaana baife abazaalibwa nga bakaali kwetuuka tibakaabatwala iganga era tibakaajya idinda. Saawa eno ekifo ekirungi era muli kubona n'obwana buli mu bulamu buli kusambagala. So twebaza obukulembeze bwa Dr. Alan Sebo n'okuwayo obulungi nti wasobola okulobinga ababulamu Health Care International okuba nti beida batuzimbira ekifo kino ate era bakitamu ebyuma eby'omulembe nga bwe muli kubibona. Sebo era Dr. Alan tukwebaza omwaka guno tubairewo medical camp ku ddwaliro lino eri Nsinze era nga abantu bangi ino bafune obwiddandabi nga okulongoosa abantu abalongoisa bino bigwaita bino ebizimba mu mamiro, abantu abalongoisa aniya n'endwaire etali da nsambu ndala nti abantu basobola okubakolaku. So tukwebaza ino era tukusaba ojje mu maiso n'okwongera okuwayo obulungi era n'okwongera okukyusa eddwaliro lyaife lino erya Nsinze Health Center 4.
Miss Maurice Lamogne. I'm the Associate Director of Communications for Bulamo Healthcare International. Bulamo Healthcare International is a non-government organization that's basically working very closely with the Ministry of Health and to strengthen the health systems out. What we're doing in Namutumba right now, we are doing 1 week of surgery intensive camp. What we do at the camp is we offer free surgeries for especially general and gynecological conditions, and these surgeries are offered at no cost to the patients who are coming through. We don't create our own systems while doing this. We work closely with the system that's already there by the government. That's why you can see we are at a government health facility. So we bring in a team of surgeons, doctors, and everything else that needs to be done. We bring in the supplies that we need, and we bring in some highly skilled doctors to work together with the doctors within the facility as well, to also, while they're offering the service, they're also doing some capacity building. This week we're targeting to do at least 400 surgeries. We did pre-screening a couple of weeks back, and we have some of the patients. This includes some a little complicated and some less complicated cases, but we try to get cases that we can manage within the camp. But then after the camp, we also have some doctors stay over to look at the patients who have been worked on within that time. These surgery intensive camps, we don't do them, it's not a one-off, it's something we do every once in a while. We do it averagely 4 to 6 times in a year. Most recently we had one in Mayuge in October, and then a previous one in Budaka in August. And we also work closely with the Association of Surgeons of Uganda in a camp they hold annually, and we are one of their main partners for that. So it's around January, February, we shall be doing another camp as well, which we'll announce. And this surgery intensive camps is just one of the many things that Bulamo is doing to try to strengthen the health systems. We offer mentorships to different health workers and the different facilities. We are working with the Department of Health at the different local governments on environmental health. And then we also offer some essential supplies to the different health facilities we partner with, which are about 104 around the country. That means every month we give them some of the key missing essential supplies that they need to be able to offer the services they need to offer out there to the people. And then outside surgery, we also very strongly focused on maternal and newborn health. So because as you can see, Uganda is one of the countries that loses the most number of newborns. So we're trying to work very closely again with the Ministry of Health to build systems, to offer mentorship, to create or establish neonatal care units across different public health facilities, so these services can reach out there. Why did we choose Namutumba? So basically, currently, we are partnering with 12 districts around the country. Namutumba happens to be one of them. So when we're working with the districts we partner with, the things that we look at before we decide where to do the next surgery intensive camp, some of them is the surgical backlog within the district. So for instance, we go to the facilities, we use the health department, we find out how many people have been reaching out needing what kind of surgeries and are not able to get that. So within this region, for instance, you realize we just did Mayuge, and immediately after we're doing Namutumba. It's because when we were doing our ground research before this, we realized there's quite a backlog in terms of people who need surgeries that they're not able to get within the region. So that's why we chose Namutumba. And it also speaks to the level of partnership and the working relationship we have with the local government as well as the facility heads. So far within this camp, we haven't experienced any challenges yet. So it's so far going smoothly, because what we usually do, we try to work very hard to mitigate some of the things that might happen. For instance, this being a one-week camp, the cases that might need a longer period of time to handle, so we screen before. Cases that we are not able to handle within the camp, we have a program we call the Angel program, where we refer these patients to specialized hospitals, and then we take care of all the bills related to that, so they can get the help they need and not to be handled within the camp, as that would be too complex for that. So right now we haven't faced any challenges. The administration has been very cooperative, the district health department has been very cooperative, and then the teams here as well. And yeah, so far it's so good.
Obubaka bwange obujja eri abakulembeze aba Namutumba nti ng'omwami ono Dr. Alani ali kukola n'amaanyi okukyusa ekifaananyi eky'eddwaliro lyaffe ery'ensinze. Mwena tuli kubasaba mujje mu maiso n'okuba nti mulobinga era nga mwogerera ensonga ey'eddwaliro lino lisobola okufuuka district hospital, twongere okufuna empeereza ennungi, kubanga nga Namutumba district tuzira district hospital. So eddwaliro binaaba nga lifuulibwa district hospital, tudda kwongera okufuna empeereza ennungi, ate empeereza eri ku mutindo, era ne referrals dijanga idinda iganga mbale binaabanga nga disobola okujja ne Namutumba kuba tunaba tunawo district hospital. Nti health center for the ife dinaba di Namutumba wano lwandona didda kulifalinganga abalwaire baife mu district hospital, ngera entambula idda kubanga ya kumpino, ndi kidda kubanga kyangu omuntu okuva Ivukula mu health center 4, okuva Magada mu health center 4, n'okuva mu di health center 3 ediri magombola gaife 20 agakola district Namutumba, okuba nti beidda kujanga ku district hospital no, era nga tebedda kuba kyajenga kasente kalira akentambula.